Hello, I'm Susan Cole.
And I'm Dr. Vanessa Apea.
And welcome to Health and Power, the monthly show all about health inequalities affecting people of colour and, crucially, what we can do to fix it.
We're joined by two phenomenal guests today, and I'm really excited about it. So I'm just going to tell you a little bit about them. So first of all, we have Dr. Christine Ekechi, who is a consultant obstetrician and gynaecologist at Queen Charlotte's in Chelsea Hospital, specializes in maternity and obstetric care, early pregnancy and acute gynecology. And Christine is a national champion for equality and is the co-chair of the Royal College of Obstetrics and Gynaecology's Race Equality Task Force, medical ambassador for the gynecological charity, the Eve Appeal, and the medical advisor for the maternity safety charity, Baby Lifeline. And then we have Mr. Charles Kwaku-Odai, who is the chief executive of the Caribbean and African Health Network, CARN. And this is a national Black-led network seeking to address health inequities by influencing policy and practice for the Black community across several prevalent health and wellbeing challenges. And Charles also sits on numerous local and national governance bodies, including the SAGE ethnicity subgroup. And he was named in the Health Service Journal as one of the 50 most influential Black and Asian minority ethnic people in health in the UK. So very, very important people on the show today.
Wow, I'm really excited about who we've got on, but I'm also feeling ever so slightly jet lagged because I've been in Seattle just a few days ago, and actually in a session with you, Vanessa, but you were joining remotely.
I was joining from Ghana, so I didn't have the pleasure of being in real life, but it was great to be there with you.
It was fantastic. So I was talking a little bit about some of the health inequities that Black women face regarding sexual health. And in one session, I spoke about just some of the issues that we face as we go through the menopause. But in the session with you, it was really interesting to just be discussing moving the narratives around conversations about sexual health risk for women around HIV, from risks to reasons. And it was fantastic. We got lots of fantastic feedback. But at the end, someone came up to me and said, "Oh, yeah, it was a really great session. But why is it all about Black women? Why isn't it just about all women?" And I did speak to her a bit about, actually, it's the racism that we so regularly face is an issue. But I mean, how do you handle conversations like that, Vanessa?
It's really interesting because I think that, first of all, that discussion was such a really powerful discussion as well. And so sometimes when people do ask questions like that after such a rich discussion, it can be quite disheartening, definitely. But I think that what I always say with things like this is that definitely. So when you think about different experiences, you think about gender, and there is a gendered experience as being a woman, regardless. But then you have to layer in that racialized experience, and that experience, that racialized experience, is not the same for everyone. Everyone has a different lived reality, and I often urge people to really reflect and think, if they were thinking about a certain scenario in a woman, where have they gotten that information from? Where have they gotten that imagery from? And I would say more than 80%, they would have gotten that imagery and that understanding from a white perspective. And so it's not about replacing, it's about bringing everyone into the conversation and allowing everyone's story to be heard. But it's difficult. And I think it's really good that you brought in clearly and comfortably about racism, because that gets lost, and naming it is part of the key part of moving forward.
Yeah, absolutely. That's a very good point. And one area where I think racial health inequalities and potentially racism is so stark is around maternal health. So I'm really pleased that we've got Christine on.
Hello, nice to meet you all. Nice to see you as
Hi.
well.
Hi, Christine. Thank you so much for coming on. So you're co-chair of the Race Equality Task Force. Why is there a need for this to be set up?
Well, it very much follows on from the conversations that you have started this podcast with. We know that we have worse outcomes for women who are Black, Asian, or other ethnic minorities that are non-white. And as an organization that speaks foremost for women and young girls in the UK, it's important that we do recognize these differences, and more than recognize the differences, put into place action so that we can reduce those differences.
Yeah, absolutely. And what role do you think racism plays in some of the disparities that we see?
Well, you can't have a race equality task force without naming racism and recognizing how race and racism underpins these differences. But it's not just a simple case of racism at the point at which women enter the healthcare system. It's about understanding how racism plays a part in our society, such that individuals then are more likely to have the risk factors that then puts them at greater risk of the poor outcomes. So in a way, it's about stepping further back. And the challenge has always been to get people to think about it through that lens. I think it's very easy to talk about getting people to not use racist language and not be racist at the point of interactions. But how do we challenge societal racism and structural racism such that the fetus of a Black mother has the same outcomes as the fetus of a white mother, for example?
Christine, you put that so beautifully, actually. I think if it's a statement that I think if everyone would just think about in terms of how can we make sure that the fetus of one woman is the same as another woman, is such a powerful image. And I'm always quite open about it because I don't think you can really underestimate the vulnerability that you can have when you are pregnant. And it's, you know, on a personal experience, I had quite difficult experiences during my delivery and after my delivery. And I remember that, as you say, I think the journey to pregnancy, because of my education and experiences, it can help me, support me to make some better decisions and be surrounded by more positive experiences. But then some of the interactions that I experienced within my care, sadly, was quite obviously determined by my race, and it was quite a really destabilizing experience. And I think that when we reflect on that and we think of how important the work that you're doing is how effective do you think that your work is in addressing health inequities for Black women and women of color?
Well, the first thing that I would say is that often and understandably, the differences in maternity outcomes tend to dominate the conversation. But it's important to understand that these differences that we see in worse outcomes for Black and Asian women extend throughout the life course of women. And for me, I think it's really important to bring that in equality, or in an equal way into the conversation, because a sick Black or Asian young girl is going to have poorer maternity outcomes. And so just to look at it through the lens of maternity actually misses a trick. The truth is, it is very difficult, because what I am saying is that a lot of the damage occurs outside of the healthcare system. It occurs when we are a fetus, it occurs in childhood, it occurs in adolescence. So for example, we're now getting very good data understanding the importance of pollutants and pollution on poorer outcomes for children and mothers and indeed their fetuses. And we know that poorer people are more likely to be in more polluted areas. And then we know, if we're to use the lens of race, that the majority of those people will be Black and Asian. So in a way, for me, it is also important to bring in class, because yes, for myself as a Black woman, I have certain advantages. I know how to outwork the system, so to speak, though I still have a worse outcome compared to a white woman of the same class as me. But what we do know is that when we look at class, Black and Asian people are overrepresented in those groups. And so this is why it's very important to talk about race and talk about why are Black and Asian people overrepresented in lower socioeconomic classes. It's not because they inherently are, it's because of racism. So therefore, I suppose I have to be more realistic about the degree and rate of impact that we will achieve through the Race Equality Task Force, and how we have to do that in combination with lots of other agents in this area if we are going to make marginal, slow, but positive gains towards the right direction.
I think that will be such a helpful thing for many people in this space to hear, actually, because when you are in the social justice space, you feel a lot of pressure and urgency to make a difference. You see urgent need and you want it matched by urgent response. And one of the most powerful realizations is that it isn't just you, it isn't just your work, and it does rely on other pieces of the puzzle. And so it's a joint collaborative responsibility, and acknowledging that it will take step by step to make a difference. So if you were reflecting on, particularly because when you talked about the life course element, which I think is crucially important, what else do you think needs to be done in this space?
Well, the first thing, I think it's to empower us all. I think empowerment is a word that's been overused and almost a bit tired. But I think it's important for us to understand that we all have agency in this space. I think it's really important for us to not also shy away from the increasing inequality we have in our society. And I don't actually just mean from a racial perspective. I mean, from an economic perspective. We walk around the UK today, we see just a huge divide between those that have and everybody else. And the more that increases and widens, the greater the poorer outcomes we will continue to see. And so it would not surprise me, unfortunately, that any gains we see in reducing the inequality differences or racial differences in maternal mortality will stall. Because actually what we are noticing is that for a big chunk of our population, we are becoming poorer. And if we're becoming poorer, we are becoming sicker. And also we aren't able to invest in our resources, not just in the hospital, but in our communities to champion preventative health and well-being. So in a way, I think it's a duty for all of us to really challenge this widening inequality, economic inequality that we're seeing, because that is the only way that we are truly going to tackle the racial inequalities that we see in health outcomes. That's just one aspect, but education, prison reform, I mean, you name it.
Yeah, absolutely, Christine. And so often, an impact on Black women is when we're in healthcare settings and we talk about our pain or our experiences, we're not believed. What advice would you give to a woman who potentially is giving birth and she knows something's wrong and no one's listening?
Well, so I get asked this a lot, and I think it's important for me to actually talk about the positives and talk about how much has changed within the healthcare system in the last 3 or 4 years in terms of understanding this issue. It's very important for me to encourage all women to feel safe within the healthcare setting, and Black women in particular, because over the first or the 2 years during the pandemic, where, of course, we became aware of the statistics, one of the very sad things that I saw was that many Black women would come to me and say that they were utterly scared and didn't want to engage in the healthcare system. So it's really important that women do feel safe within the healthcare system, being able to understand that they can voice their concerns, and being able to understand that also you can seek a second opinion. But also the onus is not on the woman, the onus is on us, the healthcare professionals. And so that continual dialogue is important. I always give an example. I cannot understand all perspectives. I am a Black woman and I'm disadvantaged in many ways. But for example, I cannot fully understand the perspective of somebody who is not able-bodied, for example. So how do I make sure that I am cognizant to their needs? And it's the same way when we're trying to understand the needs for Black women. Now, a good clinician for any woman should be able to explain what is happening at the time. And if you feel that that doctor has not explained it well, then you can ask them to explain again, or you can ask for a second opinion. But things have changed dramatically, actually, in the last 3 or 4 years. That doesn't mean that we are perfect. We have a very long way to go. But as a final note, just to encourage all women, whether they're engaging in the maternity space or not, that they really should come and speak to us.
That's wonderful. Thank you so much, Christine, for coming on.
It's fantastic to speak.
Wow, that's so powerful and important. And many of the women that I work with often say to me, when I talk to them about going and speaking to their doctor, people say to me, well, what's the point? I've raised the issue before, they're just not listening, it's going to be the same thing again. And I think it's such an issue about women, and particularly Black women, not being believed. But I think that you're doing some work, Vanessa, to try and tackle that.
No, definitely. Yeah. I mean, that lack of listening and lack of having an opportunity to safely talk about your experience, I think is something that a lot of Black women, as you say, find difficult to do, and don't have the opportunity to do, should I say. And so I'm doing some research which is called Amplifying Lives. So it's amplifying the lives of the lived experiences of East London communities, first of all. And I am looking, my first groups of focus are women of Black African and Black Caribbean heritage. And I'm going to be documenting their lived realities, their health journeys, and also their research priorities as well. And the hashtag that I keep saying is hashtag we see you, hashtag we hear you, because often we don't have an opportunity to be seen, to be heard, or feel valued in how we feel, or feel validated. And so I'm really hoping that this research is part of that solution. And the thing that's really exciting for me is that people always say that Black people, Black women don't want to get involved in research, and that is certainly not true. And also we're seeing more and more people that are becoming focused on this research. And so I'm going to be looking forward to sharing more with you as the data comes through.
Fantastic. Looking forward to hearing more. But shall we bring on Charles now?
Ciao.
Hello, Charles.
Hi.
Wonderful. Wonderful to have you on. Charles, what would you say are some of the most common health challenges that your service users raised with you?
Well, it was, reassuring hearing from Christine some of the challenges but more importantly, what is being done. I think from the work of the Caribbean African Health Network, working at national level, then it's finding out, issues around CVD, stroke, but also there was a point made about people not being believed. And one of the key pieces of work we've sought to do since the pandemic has been working to build trust with services because of the lack of access to services, and therefore our regular Saturday health hour sessions. But in CAN, there are 6 health condition priority areas that we know data tells us, as well as anecdotal evidence. So the cancers, we know about cardiovascular, mental health, we know about respiratory, conditions as well, blood, immunological conditions, but also reproductive and sexual health that we've been talking about. So all these things we've known for many decades. And in CAN, we say COVID hasn't taught us anything new. It's just shown a light because the health inequalities have been around for a few decades.
Yeah, absolutely. And what work are you doing at CAN to address these health inequalities?
So for us, it's about how we influence policy and practice, because research, Dr. Vanessa mentioned earlier on, we're really keen to make sure the voice of our community feeds into research, influences it, but also want to see many more people like us in clinical trials. So that feeds into our whole, sort of research and innovation team that we have, and collaborating with universities up and down the country is very key. But then on a practical level, we run a range of health and well-being services. So we have a Black-led counseling service providing culturally appropriate, racially sensitive, religiously appropriate, service for our people from our community. We've just started our own green and arts well-being so that we can look at African textiles, arts, the music, things that are really relevant to our community, as well as our advocacy service. People need a voice, so we have a community empowerment and advocacy service that seems to be supporting quite a number of people.
That's great. And I wanted to pick up on one of your initiatives that I'll put out a disclaimer that I know quite well because I have been on there. But I wanted to talk about your health hour specifically, and for you to describe some of the great work that's happening, but also to just get your thoughts and what's the benefit of having a health hour dedicated to Black people. And that kind of links into the question that was put to Susan post the talk. Why do we need a dedicated space, a dedicated conversation for Black people?
Right. Thanks, Dr. Vanessa. I think for many years, we've known about poor health outcomes. And we know health is wealth, but, the health literacy in our community might be low, but also we're fully aware of some of those structural issues, structural racism, discrimination, benchmarking against majority population, the community feeling deprioritized. You can go on and on and on. So whilst we're working with policymakers to really make sure the voice of our community feeds into services, co-design, co-production, it's really important that we also work with our community and do for self what we can. And so since the 2nd of May 2020, we've been having Dr. Vanessa, and colleagues Saturday after Saturday since the 2nd of May 2020, coming on for a session with the community, whether it's on fibroids, whether it's on, stroke, heart attack, spending 45 minutes just taking people through with a real focus on prevention, management, but also, any challenges that people will have. Because Christine mentioned about second opinion. Because of the lack of trust, we know for far too long, sometimes our people don't want to access services. And I think during the pandemic and the vaccines rollout, Dr. Bola and a couple of us, what we kept saying to national government is, the messenger is as good as the message. So I remember very well when the first vaccine was signed off, and we put a call out to Dr. Vanessa and colleagues wanting Black clinicians to come and talk about why they're going to have the COVID vaccine. We ended up with 1,000 on Zoom, 800 across YouTube and Facebook, and this was the 16th of January, 2021. But I think for our people, the reassurance that someone who looks like them, who understands their food, their culture, who can identify with some of those conscious and unconscious biases, and reassuring them to engage with services is quite powerful.
Thank you, Charles. And no, I completely agree. And, I want to commend your organization for the work that you have been doing, because it's been a privilege to be part of it, but it's really powerful work. And you mentioned about the vaccine response, because one of the reflections of the vaccine response was that organizations such as yourselves were brought in too late. And I wanted to get your thoughts on that, and also just your reflections on how important is engagement with communities that are most affected right from the start. How important is that to have it right from the start to really bring about meaningful change?
Thanks, Dr. Vanessa. I think people can read out there about co-production, co-designing. But yes, we were an afterthought. I think when the first household survey came out saying Black and other ethnic minorities were least likely to have this, it shouldn't have been a surprise, because year after year, the uptake of flu, from our communities is low. And yes, we have lots of knocks on doors, lots of engagement. But unfortunately, our real frustration now is, losing some of the lessons we learned from the pandemic. There was a whole trusted voices scheme that goes back to the point about people who look like us leading the charge, leading the discussions and conversations, because a key aspect of what needs to be addressed is the lack of trust. And this lack of trust is not just limited to our health and social care system in the UK. But when Pfizer was signed off, for example, people said, we know Pfizer's track record in Nigeria. how they didn't adhere to robust ethics, and participants, unfortunately, some became disabled, and they didn't know what they were taking part in as part of the clinical trial, but also the Tuskegee trial. So one of our clinicians who has been coming on time and time again, he usually played the video from Bill Clinton that was apologizing to Black people. But also what we've been able to demonstrate is that Black-led organizations can work together. So with the Saturday morning sessions, for example, we have 5 partner organizations in Leeds, Sheffield, Birmingham, and London, and coming together so that we can extend the reach, and engage our communities that we know really, really well.
Wonderful. And I think it's fantastic, the impact that you're having, because I think sometimes that we get invited to be involved in projects, but perhaps it's maybe slightly more tokenistic. But how do you go about ensuring that your engagement is meaningful and impactful and can bring about real change?
I think, thanks, Susan. Dr. Vanessa mentioned having us early at this, involved in it. And I think for CON, we didn't just give out information. We actually run clinics. We have Black nurses that were willing to volunteer for us, but not willing to do extra shifts in the system. So therefore, involving communities who understand, the challenges within those communities is really, really important. And that's why we keep knocking on doors, making sure we have a visible presence on social media. But the real assets, are Black, Caribbean, African clinicians who look like us, talk like us, understand our foods and challenges. It's been brilliant having them, and they've made the difference and given us that unique selling point.
Wonderful. Thank you so much, Charles, for coming on. Always a delight. Oh my goodness, I think we haven't got much more time, Vanessa, of the show.
No, it went so quickly. But I always feel that it's just the beginning of the conversation, but it's great to hear people's role in trying to effect change. And I think it's really good to just learn about how people are doing it and how people are navigating that space.
Absolutely. And I so much agree with what Charles was saying. Having people like you out there doing the work that you're doing is making so much of a difference. And also it's just breaking that narrative. I think sometimes we are depicted as sort of like passive, voiceless victims that need to be saved by other people. But I think having people like you and doing the work that you're doing makes such an enormous difference.
Well, I have to say, I always talk about collaborative action, but one of the beauties was that I met many people who look like me in the medical space that I hadn't seen before. And so it was it was a positive time in that respect, so that you weren't working in silo and you were bringing people together. So definitely.
But there has been quite a lot recently in the news about racism in the health system affecting staff.
Definitely. And one of the most damaging things about racism and experiencing racism is silence. So because with the overwhelming feelings about it, it is quite, I wouldn't say easy, but the default way is actually to be silent about it and try and look after yourself as best you can be to pick yourself up and go into work and respond. And so I think one of the most powerful things about hearing about that experience is the great strength that nurse in question has had to actually challenge the system and speak out. And I completely applaud her.
Absolutely. And we really are out of time. So could carry on this conversation for hours. But thank you so much, everyone, for joining us today.
Thank you so much. And I have to say a huge thank you to our guests, so Dr. Christine Ekechi, Mr. Charles Kwaku-Odai, who have joined us. It's been fantastic.
And I'd like to say a massive thank you to Disruptive Live for doing their technical wizardry and having all of this go on, and to the National Lottery for supporting Health Empower. And we will see you for the next episode, which is when, Vanessa?
It is on Monday, March 28th.
Wonderful. So we will see you then. Thanks very much. Bye-bye.
Bye-bye.